My name is Cassandra Munoz, and today I'm going to be going over client education and what the patient may be experiencing during an MRI. MRIs are used in neurological assessments to evaluate the cranial activity in a cross-sectional imaging. MRIs are usually preferable as it's low radiation, so it's not too harmful for the client's cells when they're regenerating. MRI scans are usually to check out if there's any abnormalities happening around the brain and near the cranial activity. This could be tumors. It can help guide providers when they use needles during their biopsies. And it can also see if the patient is tolerating a treatment well or not. The very first steps we want to do for the client is ensure that the client is wearing absolutely no jewelry, no belts, nothing of that sort, as it can interfere with the magnets inside the machine, and as well as allergy to iodine because of the contrast media that will be injected into them. We want to make sure that we question the client as to any type of pacemakers, any of that sort that they might have, as well as a history of claustrophobia. If the doctor's orders are to sedate the patient for a certain amount of hours, then we want to make sure that the client knows that they should refrain from eating and drinking for up to that period of time, around usually 46 hours. In doing all of this early patient education, it should help the operation go by smoothly for you and the client knows what to expect. And the next thing you want to notify the client is that you're going to have them lay down supine. Sedation can be an option for the client when they have claustrophobia. And another option would be earplugs, as the MRI can be noisy, so that's to be expected, and that's something you want to inform the client. Another thing is notifying the client that they shouldn't be moving their head at all. Another type of abnormality that can be detected earlier on involving MRI would be Parkinson's disease. And it's with this image right here that is how the MRI will appear if the client is showing signs earlier on of Parkinson's disease. So that's another cool feature of this diagnostic test. So I mentioned there's contraindications to MRI being claustrophobia as well as pacemakers. The claustrophobia can be dealt with with sedation, as I stated before, but you also want to make sure that your client does not have any cochlear implants. And another thing I found to be interesting was a contraindication of a client with diabetes. And I found out that it is because the contrast media does contain a certain amount of glucose inside of it. So it has a potential to raise blood sugar in those diabetic patients. So you want to also check their medical history before initiating this type of test. Prior to the MRI, you want to make sure that they arrive there about 15 to 30 minutes early before the test so they can fill out the MRI form, so that way that we know that they're ready to go and nothing is contraindicated in that form for this patient. You will hand them a hospital gown or any type of covering and give them privacy. And at these types of MRI facilities, there can be lockers available for them so they can put their personal belongings without having to worry about getting damage inside the room. Also notifying the client that this procedure can take up to an hour, so they want to possibly just use some relaxation techniques, some listening to the music, anything to try to stay relaxed and just not moving at all. And just notify them that the procedure can take up to an hour if at any point they're uncomfortable. Rather than move around, sometimes talking over the monitor can also help the client relax, or just have them listening to music, whatever brings them more comfort during this procedure. So if at any point the client feels that they're unable to hold their position or tolerate this type of test, they are given an alarm so they can activate. And this type of alarm will notify those inside the room with the client that they are not tolerating it well, something's making them uncomfortable. So at that point, we would have to stop the test. So this is another reason why often providers choose to sedate their patients, so that way they're more relaxed, less anxious, and they're not moving around. If the provider has ordered the sedation, then you will have to have someone with you, and that is something to notify the client that they cannot go to this test without anyone else to drive them back home. And for pediatric clients who will be undergoing MRIs, you want to show them a pretty fun educational video that involves MRIs so they have a better understanding of it. Let the child know, just the same as the client, that hey, you're going to be hearing some kind of noises, but that's okay, that's to be expected, so the child can calm down. Also included in the client education of MRI, you want to make sure that both adult and pediatric clients utilize the bathroom before the diagnostics test, because it will be almost an hour, as I've stated before. After the procedure has finished, you want to make sure the sedation IV is out of the client's arm, and you want to ensure that there's no erythema, any rashes, no hives, anything like that. And after the provider has given it an okay to go, then the client is free to go with the person who is driving them. And if non-sedated, they are free to go whenever they feel more alert and awake. Okay, so this concludes the MRI patient education, safety, and contraindications involved during this diagnostic test. And goodbye.